Surveillance testing at Bukit Merah View yields 5 positive COVID-19 cases. More than 2,100 residents and visitors across 8 HDB blocks took part in the 2-day swabbing exercise. Let's take a closer look now at today's COVID developments. For that, we're joined by infectious diseases expert Dr. Leong Hoe Nam. Dr. Leong, welcome again. Now, surveillance testing looking to be increasingly important in the Singapore landscape, given the number of cases that are being uncovered. Can and should this process be tightened?
Ideally, you want everyone in the area to be surveyed, to actually analyze and see if they're positive or PCR negative. But if you think about it, everyone has their own job and everyone may have a fear of having the swab test, or even worse, the fear of being diagnosed COVID-19. We do see people who have symptoms who have been asked by doctors to go for a swab test, but they deliberately didn't, and it turns out to be COVID positive. So there is a stigma attached, and that makes execution of this very difficult. And do we police it? Do we force people? Do we get police to get them out of the house for testing? We can't. At the end of the day, it's very much voluntary. We can try as much as we can. We push as hard as we can. And all of us just have to do our role as a Singapore citizen, a loyal, patriotic one, to get tested.
Yeah, there is an element of having to step forward with this sort of thing. How critical, though, is the timing of these surveillance testing operations, and how quickly do these have to be called to ensure minimum seepage into the community?
There are two issues. Number one is, where did the patient come from? How was the transmission happen? So there's probably one or two other individuals at least who's passing on. So you want to do that first catch. And thereafter, you need a second catch as a final sweep to actually find everyone that has not been caught earlier on, because their symptoms may develop later. So it will be quite a bit of timing. 2 sweeps. The first sweep should be done as quickly as possible, ideally within 2 or 3 days, and the final sweep at about day 12 to day 14.
And as we're seeing more and more people get vaccinated, is it also going to be harder to weed out cases? Is that a concern for you?
Great question. In fact, there are many people out there in the WhatsApp chat and social media saying that by vaccinating, you kind of hide the patients because their symptoms are much milder. There's some truth to that, but that's exactly what we want. We want patients to have very little or no symptoms at all, because there'll be no demand on the hospital stay. So that makes hospital and doctors' life much, much better. Now, we do know patients who have been vaccinated, they have a lower risk of transmission to other people. So among fellow colleagues, the risk falls by 94%. Incredible. And within the own household, the risk falls by 50%. So even if you're vaccinated, you have little symptoms, you may not be picked up, but your risk of transmission to other people is lower. So we have a greater benefit in terms of lower transmission, less demands on hospital. So vaccination all the more should go through. And if you do have a contact, we will pick you up with a swab test. But have no fear, because you are going to coast through the illness with little or no problems.
Yeah, speaking of vaccinations, we're getting a batch of vaccines called Comirnaty. I want to get your thoughts on, because health authorities say it's the same as Pfizer-BioNTech, just manufactured presumably different in different European countries. Are you confident about this?
Absolutely. If you think about it, for these companies who actually do worldwide distribution and manufacturing of these drugs, they have a very strict criteria on how things are done. So, which is like the quality controls, the materials that are used, the whole manufacturing process, etc. And along the way, there are many, many checks to make sure that the right ingredients with no contaminations go through the whole process. And even then, there's batch tested on animals to show that the vaccine works the way it's supposed to work. If it doesn't work, the whole batch is lost, and that's the end of it. So I'm actually very confident, because the companies that actually do it have been doing this for many, many other drugs, and they have done it similarly for all the different manufacturers. And if you think about it, there is a big demand for this vaccine. This vaccine is worth its weight in gold, which means the more manufacturers there are on board, the better. And there'll be slight differences, but the differences are negligible.
Infectious diseases expert Dr. Leong Hoe Nam, thank you so much for your thoughts there.